Good morning, everyone. We have such a wonderful group here with us today, so thank you so much for joining us on our first Interfaith Community Services Zoom webinar. So thank you for being here. Thank you for bearing with us. As I mentioned, this is our first time trying this type of technology. I also not only thank you for joining us, but thank you for all that you do to support Interfaith. We have such a great group, whether you are involved as a community partner, involved with one of our partner faith centers, a volunteer, a donor, giving monetary donations or in-kind donations. You truly make this work possible. So thank you for helping us continue to be here during this very, very trying time. So I'm going to cover some, well, let me first introduce myself. I'm Chelsea Buck-Lilac. I'm the Director of Development here at Interfaith. I know a lot of you, so hello, I can't see you, but good to see you. I'm going to cover some housekeeping stuff and then we'll get started. The webinar is scheduled for 1 hour, so approximately the first half will include presentations from Interfaith leaders, with the remainder dedicated to questions and answers. You can find the question and answer or the Q&A box on the bottom of your screen. Click the More tab if it isn't already visible on your bottom taskbar. So any technical issues can be submitted in that Q&A box and someone will answer you directly. You can also call Jay for technical support. I see that he just put his phone number in the chat box, but it is 760-803-1498 for those of you who perhaps are having trouble seeing the chat box. That's 760-803-1498. You're welcome to submit questions throughout the program. They'll be answered during the second half of the webinar. There's an option to submit questions anonymously. Otherwise, we'll read your name as the questions are read and answered. Lastly, in terms of housekeeping, the webinar is being recorded. However, guests or attendees are not visible. Okay, so I would love to introduce our CEO, Angel, who a lot of you know. Greg is going to walk us through our Escondido headquarters, program managers, and leadership at other Interfaith locations will then share the work you all are helping possible as we respond on the front lines to the current COVID-19 pandemic. So I'll turn it over to you, Greg.
Awesome. Thank you, Chelsea. And hey, thank you everyone for joining us. We're so excited to have you here at Interfaith Community Services. I'm in the parking lot of our Escondido headquarters, and we're going to bounce around to a few different locations throughout North County today and give you a chance to really get on the front lines of what you're supporting and how we're helping our community. So first, I mentioned I'm here at our Escondido headquarters, and I'm outside in the parking lot because this is where all the activity is happening right now. You can see behind me, we have some food that's being put together. Like, say hi, Emmy. And then we have our food pantry, and we have one of our faithful volunteers here helping out, Mr. Kelly. Thank you, Kelly. And you got the whole team here putting together food packages. And this is really important because we're seeing a truly unprecedented number of people turning to us for food assistance. And we are providing food assistance in a way that is safe and in a way that is client-centered. And so all of our services are happening outside at social distancing distances in our parking lot. I'm gonna walk around a little bit today while we're talking, and I'm going to be really careful to not violate anyone's privacy. And so you may see some interesting moves from me as I avoid individuals who are here who haven't consented to be a part of our webinar today. But I do want to give you a sense for what's going on. So I'm going to walk a little bit down here, and you're going to see over my shoulder a row of cars. All of these cars are all people who have come here for food assistance, or in need of rental assistance, because they've lost their jobs, or because they have jobs, but their jobs have reduced hours. And on a normal day, like today, when we have food assistance available, we would see anywhere between 30, 40, 50 families on a busier day in normal times. Yesterday, our system here, you can see it set up behind me, provided food assistance to more than 600 adults and children, and connected them to a whole lot more than just food support. And to talk a little bit more about that, I'd like to introduce you to one of my colleagues, our Director of Supportive Services, Veronica Blea. And Veronica can talk a little bit more about not just the food we're providing, but how we're starting a longer conversation and a deeper dive of how we can work to help people in this time of need. Veronica, are you there?
Yeah, I'm here. Hi, everyone. Thanks, Greg. Appreciate it. So as you see with the tour that Greg's given, we've definitely changed how we provide services, but I almost feel like it might be a little bit more client-centered now, or at least with customer service. So now they can just drive through and get the services they need, which I think is super cool. We have someone that's at the gate over on Quince who is at that point over there, we're checking to see what exactly they need, and all the spaces on cars have designated services that we're providing. So if they're here for medical assistance, through neighborhood healthcare, then, we're saying, okay, hey, is spot 5 available? And then we're able to radio over to neighborhood healthcare and say, hey, this is for neighborhood. So as you can see right there, what Greg's showing, that's for taxes. So we are probably one of 3 sites that are still open for our VITA, which is the free tax preparation. And right now, I think it's more crucial than any time to really make sure that we're getting those refunds out in the community. Again, like you guys know, everyone's struggling. Like Greg mentioned, people are losing their jobs or at least minimizing hours. And so we know how important making sure that they get their refund is. So we're continuing that. We'll have them bring their documents in, and we're checking them while they're in their car. We're completing their taxes. We're taking them out there. We're on the phone with them, asking them questions. So, it's as virtual as we can possibly do it. We're also providing rental assistance as well. So if individuals come in, they're able to ask to see, what we have available, whether it's COVID related or not. During this time, we have noticed that, individuals definitely are needing more than just the normal, $500, $600, again, because, potentially these individuals have been out of work since March. So March, April, they're behind, potentially even May. So the goal is for us to try to support them during this time. So, they're not getting evicted, but at the end of the day, they still have to pay that. And so we're hoping to be able to minimize what the damage is at the end. So instead of them owing $5,000, they're owing, $2,000. So we're doing our best to minimize that. Individuals are coming in to get unemployment assistance. So it's been a while since individuals have actually been able or know how to apply for unemployment. So our case managers are helping them do that to make sure that they are getting that assistance. Behind Greg is our, are you in the computer lab? Yeah?
I am.
So if individuals need to come in, we'll bring someone in one at a time with proper PPE, which is really exciting, right? Like the clients are feeling safe, case managers are feeling safe. We'll bring them in right there so that they're able to make phone calls there, apply for unemployment. And again, we're doing that as a team with our case managers. In the front, we still have mail service. So all of that's going on still. We have individuals right there. We're separating mail, making sure that our clients are getting it. And again, they're all our face masks and our gloves. And so it's been fun. So I don't know if I missed anything. We're still providing as many services as we possibly can remotely. So case management is still happening over the phone. Our case managers are home, are following up on a regular basis with them. We try to, again, be as client-centered as we possibly can. Again, we do understand some of our clients are higher needs. Haven House is still open. I don't know if you want to go into Haven House, Greg, but Haven House.
Sure.
We are,
yeah, I'll jump over to Haven House, and I was just showing our viewers, they may not have been able to see it too closely, but our on-site health clinic with neighborhood healthcare. So,
thank you.
So we have medical professionals here providing those services, and then we're also screening individuals. You can see the medical tent behind me before they enter the building. And as you saw, we have more space available so that we maintain that social distancing. And then Veronica, I'll walk through Haven House while you talk.
Okay. So in an effort to just make sure that we encourage and promote social distancing, our max capacity for the shelter right now is 20 individuals. Again, just to make sure that we are promoting social distancing. And we have also changed our shelter to be 24 hours. Again, if an individual doesn't have a place to shelter in place, then how will we keep them safe? And so we really have changed that so that clients can stay on site all day, 24/7. We're providing food. We have a dog in our shelter right now, which is awesome. He's such a good puppy. Anyways, we 24-hour shelter again to have people shelter in place. And we provide the food. We provide all of that for all of our guests at Haven House. Yeah. I think his name's Charlie. Yeah, he's a good puppy. All right. Greg, do you think I missed anything? I think I covered everything.
I think you gave a great overview. Thank you, Veronica. And we are going to have an opportunity for Q&A. So Veronica is going to stick with us. And I want to introduce another one of our program leaders to share about what we are doing at a different interfaith location. So Veronica walked through the basic needs services, kind of that first conversation that we're having with literally hundreds and hundreds of people every day, just here in Escondido, and providing services like our shelter and food. We're also continuing to provide our recuperative care programs. And so I'd like to introduce our director overseeing our recuperative care, Mr. John Lewis. And John is at our recuperative care center, the Hawthorne Center here in Escondido, and he's going to share a little bit about how we're helping people exiting local hospitals. John?
Hi, everyone. Thank you, Greg. So yeah, the recuperative care program, we're the only recuperative care program of its kind currently in San Diego County. We're a 32-bed, 24/7 facility that provides community-based residential care and treatment for individuals experiencing homelessness and needing further recuperation when being discharged from local hospitals. We aim to provide interventions to decrease the risk of hospital readmissions, improve quality of life, decrease reentry to the streets, and improve recovery from acute illnesses. The recuperative care program is designated to provide quality emergency housing, services to the most vulnerable and at-risk individuals, which are those with mental illnesses or medical issues. We provide supportive services necessary for mental health and/or medical recovery for each resident. The areas that we address but are not limited to is medication stabilization, relapse prevention, healthy lifestyle maintenance, establishment of income, and of course, securing transitional or permanent housing. We try to take a harm reduction approach in order to meet our residents where they're at when it comes to substance use. So we regularly coordinate with our detox and residential program, which is currently located at 550. Last year alone, 75% of those we served successfully completed the program, having stabilized their medical condition that led to their initial hospitalization, and we were able to move them into transitional or permanent housing. During this pandemic, we have been able to prevent 46 individuals from returning to the street. We were able to house 19 individuals with another 14 pending housing within the next month. So even with all of our community partners changing how they do things, currently not accepting individuals, we're still open. We're still serving those that we can and trying to make sure that they recover from what led them to go into the hospital.
Thank you, John. John, is there an individual who we've supported recently through recuperative care whose story you might share with our listeners?
Yes, so we recently had a veteran. He was here in our recuperative care program, him and his emotional support animal. This was someone who was homeless for around 2 years. And we were able to, get him connected with his emotional support animal because it was staying someone else. And then he was here for about 90 days and we were able to find him housing and transition him to permanent housing while he was here.
That's awesome. Thank you so much, John. Thank you for doing the work that you're doing. And our teams are staffing the recuperative care 24/7 with nurses, behavioral health specialists, licensed clinical social workers, case managers, and it's a partnership with healthcare. So it's one of the rare programs that we don't have to rely upon community support to make possible. Community support created the center where John is at, and our healthcare partners pay for the operations of that program.
Yeah.
It's a great investment. It saves money, and most importantly, it saves lives. Thank you, John, for being with us. I want to invite our viewers to get a glimpse into what's happening out on the coast. We have a Carlsbad Service Center that is going like gangbusters, and we're joined now by one of my colleagues, an amazing individual who not only manages our Carlsbad Service Center, but also runs some of our school-based programs, our Transitional Youth Academy. And she's going to talk about the Carlsbad Center and what we're doing there. Vanessa.
Good morning.
Hello, Vanessa.
All right, so you can hear me okay?
Yes.
So I'm actually going to flip my screen around so that you can see our services in action right now. There we go. So this is our Carlsbad Service Center. I just left information in the group chat about what services we offer here, how to contact us. All clients do need to make an appointment in order to come and receive services here, but we offer all of the services other than shelter, laundry, and showers that we offer inland in Escondido. So as you see right here, this is our computer lab. So we are allowing some individuals, if they need to utilize the computer, to come in as long as they have all proper PPEs, and we allow them to come in one at a time. We also make sure that they hand sanitize and check their temperatures before they come in as well, because we do serve a lot of individuals who are experiencing street homelessness, because regularly we would have this lobby full with individuals who are participating in our day labor program. So we do have some sack lunches available that we leave right outside the door for individuals to pick up. And as you can see, all of our case managers have their safe offices that they are working from. And then as we go into the back here, you'll see our pantry and Miss Jackie, who is just finishing up providing emergency food. So we have diapers, lots of hygiene kits, and then a fully stocked pantry with proteins, soups, everything that you can think of. The other item that we have here, we have our refrigerator and freezer. So if individuals are looking to make a donation to our pantry, just know that we also have that available here as well. We do have funding that is specific for City of Carlsbad for rental assistance, but we will provide assistance with all of the other cities as well.
Vanessa, thank you for walking us through. Vanessa was supposed to be off today. She's worked 11 straight days. And Vanessa, like a lot of staff here, is not only doing her day job, but she's volunteering to fill in at other locations. I moved into our cafeteria here at the Escondido headquarters, and we have a lot more staffing needs than we had before the pandemic. 90% of our volunteers, we rely upon 600 trained volunteers. 90% of them are unable to come in to provide in-person services due to age or health condition. And so our staff have really had to step up. And Vanessa, you are one of many doing so much, and I so appreciate you taking the time to come in today and share with the team and everything that you and the team are doing there at Carlsbad.
Of course, thank you.
All right, also out on the coast, we have homeless outreach teams that are in normal times spending their days out in the community, outreaching to individuals who don't have housing. We do this in partnership with the cities of Escondido, Oceanside, and Carlsbad. And right now, during this very unique environment, we are also managing 2 motel sites, an 80-bed motel in Escondido and a 40-bed motel in Carlsbad, that we have moved individuals who were homeless, who were unsheltered, out of that situation and into housing so that they can safely shelter in place during this crisis. And one of our clinicians overseeing that work is joining us today, and I'd like to turn it over to her to talk a little bit about how the motel shelters are working and some of the amazing work that is happening among a very vulnerable population. So I'd like to turn it over now to Brenda Preston, who is joining us from her office in Oceanside. Brenda.
Thank you, Greg. Thank you, everyone, for joining. As Greg mentioned, I am Brenda Preston, Clinical Outreach Manager and Licensed Clinical Social Worker. Today, I am joining you from my office in Oceanside, where I support my homeless outreach social workers who work in partnership with the local police department. In response to COVID-19, our outreach teams have continued to provide direct client support. The need to keep our homeless community connected and informed is great. While we do continue to provide outreach support in the community, in addition to this, my teams have played a vital role in supporting county efforts via the motel voucher program, in which those who are the most vulnerable in our community have been identified and housed to comply with shelter-in-place guidelines. This program was developed to support our most vulnerable homeless population, to include our older adult population and those with chronic medical conditions. In thinking about who are most at risk as a prevention strategy and to address the needs of our most vulnerable, the aim of the program has been to provide stability and a safe housing option for those who otherwise would have nowhere to go, with a strong focus on wellness and overall individual well-being. Utilizing my team's skill set and relationships with the homeless community, as of today, we have been able to provide secure shelter for over 40 individuals via this program here on the coast alone. Knowing the importance of empowering those who are most vulnerable during this uncertain time, staff at the motel are prepared to offer wraparound services. This includes case management, linkage to community providers, on-site access to public health nurse, as well as important assessments to address long-term housing needs and resources. As one can imagine, for individuals experiencing homelessness, most of the time is spent in survival mode. Where will I sleep tonight? Where will I eat? What will tomorrow bring? Not allowing the opportunity to think about their health, let alone attending medical appointments. Clients often report losing or having their phones, identification, and belongings being stolen, making it very difficult to attend or keep track of important appointments. In understanding this, we have partnered with community providers to address these needs. And as part of the wraparound services being offered, clients are assessed for individual needs, developing goals and connecting them with services tailored to address unique gaps in their lives, whether that be medical, housing, financial. As an example of one of the many needs being addressed, our dedicated interfaith clinicians and case management team are currently assisting folks who do not have an income connect with potential health benefits, providing peace of mind and hope for their future. We understand the struggles that these folks have extend far beyond the pandemic. And with the uncertainty surrounding their future and life after leaving the motel, our goal has been to empower them by bringing them resources, meeting them where they are at. While many others are working from home these days, our great interfaith staff have risen to the challenge and continue to meet with folks on a daily basis, 7 days a week, where they continue to provide support and reassurance during this uncertain time.
Thank you, Brenda. I so appreciate you joining us today. I know how busy you and your team are, and the remarkable work happening with everyone who is sheltered now in Carlsbad for the first time, many people in a very long time, and the great opportunities to support them moving forward. We have an opportunity now for some Q&A, for some questions from participants on the tour here. Chelsea, I think you're going to moderate our Q&A part of the.
Yes. Well, thank you, team. So great to hear from all of you. Thank you, Greg. We have some great questions that have been coming in, so I'm just gonna start shooting here. Let's see, Greg, besides dollar donations, are you accepting any type of in-kind donations? And also, what do volunteer opportunities look like at this time? That's from Christine.
Cool. Well, I'm going to show you what volunteer opportunities look like right now. We're preparing lunch for the residents of our drug and alcohol treatment program, and also our Haven House shelter. So we have volunteer opportunities to serve food, and we have volunteer opportunities to work in our food pantry. Serving hundreds of people a day, we need volunteer support. On the, what's that? Mike. Mike, you want to say hi, Mike? There you go. Thank you, sir. We also have volunteer opportunities on the coast. Vanessa, are you still with us? You want to speak to what some of the opportunities are there?
So along the coast, really our volunteer opportunities are primarily from home, only because we have a smaller space, so we don't have enough room to maintain social distancing with anybody other than the staff who's here. But we're definitely taking donations for our pantry. We have some admin, special projects and things like that that we can also send off to folks who are interested in helping us with that.
Perfect. So we'll do a follow-up to everyone with those details. In-kind opportunities for donations. We need face coverings. The reality of the need for these is going to be here for a long time to come. So we not only need them for our staff and for our volunteers, but as importantly for the clients who we're serving as well. So that's a big need. PPE itself, hand sanitizer, disinfectant wipes is in very short supply, and we go through a lot of it because we're cleaning all of our hard surfaces like crazy, and we're pretty focused on creating the safest environment possible. So those in-kind items are needed, and food. You can only imagine how much food we go through when you feed 600 people in a single day. And I want to say, when it comes to food, we're not the food bank. So we're not here to provide food on an ongoing basis for everybody. We connect people to other resources beyond what we're able to provide. So I want to show you just one resource list that we're providing today. And this is a list of other food distributions that are happening today, just today alone, Friday, April 17th. There's about a dozen on here. Our team prepare and update this on a weekly basis. So when somebody comes here, they're getting grocery assistance, and then they're getting resources to where they can get additional food in the future. And that's just food. Like Veronica said earlier, it's really so much more about providing the financial security that people need, whether it's applying for unemployment insurance if they've never been out of work, never had to do that before and don't know how to do it, or returning to work, and also providing PPE for those who are returning to work. Pretty much every job that's hiring out there right now requires public facing. So we had one donor who hand sewed masks and dropped them off to Vanessa earlier in the week. Those are going to be for people going out to work. That same donor made masks that went to our motel in Carlsbad for the residents there. So those are great donation opportunities to support what we're doing.
Thank you, Greg. Related to that topic, which works best for Interfaith, a cash or online donation, or purchasing items to be delivered to Interfaith?
They both work really well. So if you want to come by and see us in action, you can do a drive-through donation. You don't have to get out of your car. You can if you want, but we'll unload the car. We'll give you a receipt, and we will put it into play immediately, same day. On the other hand, if you donate cash, we can use that to stretch a lot farther than you would if you went to the grocery store and bought food on your own. Because we do work with the food bank, we do work with Feeding San Diego. They have even further reduced rates than they normally do. We can really get a lot more bang for your buck than if you were to go out and just spend, say, $100 at Costco. So either are really great options.
Thank you, Greg. Veronica, looks like this one is for you. Have you used any human-centered methods to rapidly prototype, and how did you brainstorm these solutions?
Yeah, it's actually been really, it's been great to see the team just kind of come together. So like Greg mentioned, we have more staffing needs than we've ever had before. And so we have individuals from different departments who are coming over to support our distribution in the front, and just how we kind of function now in this, social distancing world that we're in. And so it's really great to hear their perspectives. And, when it first started, we had, someone from the supportive services team, someone from the housing team. They just were like, this isn't going to work. Can we do it this way? And so they were very hands-on, very quick, really responsive. And then when we have clients that will call us, making sure that we're, again, staying client-centered and making sure that they're involved in their own solutions. So they'll give us a call and say, you know what, like, we're having a really hard time getting there. Just the other day, we had a senior who, she was really scared to come out of her house and she needed rental assistance. And so she's like, her and the case manager were on the phone for like 2 hours trying to figure out how to help her with her computer. She has one, but she wasn't very computer savvy. And so she's like, I can't do this. So the case manager was like, you know what, I'm just going to go deliver the documents to you. I'll put it inside and we can go through it together. So she went and delivered the documents again through like her mailbox. The client was able to get it. And then the property management company supported the client to get it sent back to us. Like within an hour or two, we had all the docs ready and we're actually cutting a check for her this week. So it's just really cool to see like how staff from all departments that aren't usually doing this type of work come and give us like a clean perspective, as well as making sure that we're listening to our clients and making sure that what they need is happening as well.
Wow. Thank you, Veronica. Thank you. Maybe this is a good one for you as well, Veronica. Have you had to turn away people needing a place to stay due to reduced capacity at Haven House? Along with that question, what challenges are we having in handling social distancing in the homeless shelter environment?
So we have really tried very hard not to turn individuals who are at high risk away. So age 65 and over, a chronic health condition, like Brenda was saying, we do have a hotel on the coast as well as inland. And so anybody that has high needs, we've really made an effort to not turn them away, connect them to healthcare, get them tested, and then put them in one of those isolation hotels for individuals that, again, at high risk. And so that was our priority. Unfortunately, we can't keep everybody in the shelter again because to promote social distancing. So we have had to tell individuals that we don't have the space right now. So unfortunately, we have had to turn people away. But again, we really made every effort that we possibly can to get the most vulnerable off the streets and into some type of isolation location. So yes, we've definitely had challenges at the shelter, and to ensure social distancing, I think we've taken, so for example, we have like a common area. We've taken away a couple chairs, so not everyone's sitting in the common area all at the same time. We've given every individual in Haven House PPE, so they can have gloves every day and face masks. So if they are less than 6 feet away, they do have the proper PPE. So again, and we're just constantly reminding. We have signs everywhere, and we have case managers that are in there, just reminding our residents to wash their hands and sanitize, and just make sure that we're trying to be as safe as possible and practice social distancing.
This one is for Greg and Veronica. This is from Bill Loftus. Hi, Bill. I have been asked about food assistance in North County. San Diego Food Bank is doing a lot in the county. Who besides Interfaith is providing food to the needy in North County?
So there are thankfully a number of organizations still providing food. I'll show again what I scanned to earlier. This is a list of organizations providing food assistance today alone: North County Food Bank, Jewish Family Services, Brother Benno Foundation, Community Resource Center. It goes on. We confirmed the details. There's also the address and the time. This is all just for today. So there are a number of other resources out there where our sweet spot really is being able to provide food here, provide other resources like I just described, and then also get down into, why is there a need for food? And if we're seeing 600 people a day when we used to see 150 people or less a day, what are the causes? And it's primarily employment related at this point. So we're helping people to address that employment issue. And as Veronica talked about, we have the mechanisms in place to provide rental assistance. She began to describe the details where you get a sense that we're not just handing checks out to people, we're verifying the facts with them, with their bank, with the landlords, with their employers, that they're going to be able to make ends meet on a normal month, but hard times have happened. That's what we do in the the past, pre-COVID, helping with $500 to $1,000 of assistance usually, and it's directly to the landlord. The reality now, though, is that we know we're going to see needs much greater, because when individuals are out of work for many months, even with the eviction delay that is in place, those bills as of today are still going to be due. And the hundreds of people that we're working with are going to have a hard time getting caught up. So we're going to be here to help them try to get caught up, and we will use your donor support as the last dollar in when we've exhausted every other resource out there, every government resource, every resource that the individual themselves has to keep them housed. And remember, your support of Interfaith Community Services ended or prevented homelessness for more than 2,000 people over just the last 18 months. So we have the right people in place and the right relationships and mechanisms to do this. It's going to be really important that we have this support to do it.
Yeah. Thank you, Greg. And we have a couple of people asking about how to make online donations. Thank you, Jennifer and Jay. I see that in the chat bar you have included the link for making donations on our online donation page, as well as some instructions if you want to donate directly to our emergency COVID response fund. So thank you, guys. Greg, what percentage of the county's homeless is Interfaith able to get into shelters and transitional housing? That question is from Diana.
We have pre-COVID, we had about 500 people sleeping within Interfaith residential units on any given night. And that's a mix of shelter, like you saw our Haven House shelter, to our residential treatment programs, our recuperative care, transitional housing. We have about 60 beds of transitional housing for veterans in Oceanside, male and female, and then also permanent housing and affordable housing. So about 500 on a normal night. Add to that now 120 motel rooms. So we're serving a good number, but the reality is in North County alone, the annual point in time count found almost 1,000 unsheltered people. 1,000 unsheltered people just in North County on just one night in January. So the reality is there are far more people out there. We're working with our North County mayors and also with our county supervisors to further a plan to create more shelter in North County. And it may look like more motel sites. It may look like other short-term shelter options. We're particularly interested in how we can help the 120 households that are in motels now get into housing, and if they need to get into treatment and other things longer term. Brenda, if you're still with us, I'd love to hear your perspective on just what some of the opportunities are that are available. You spoke about it earlier, but you also do so much outreach in Oceanside and in Carlsbad, and just some of the needs that people have that we might be able to address during this crisis.
Absolutely. So for our outreach teams, we have really shifted into being the source of information, right? So the way that our folks were previously getting their information, whether via the library, is no longer an option. So our team continues to go out there. They continue to let folks know where are the resources in terms of food, in terms of shower, hygiene kits. We've also partnered, like I mentioned, with the public health nurses. So we have that great resource where if folks are feeling symptomatic, we have that opportunity to connect them right away. We've been able to link folks to primary health care via our motel voucher program. For the first time in a long time, folks don't have to worry about a place to sleep. And so this has allowed the ability to connect them with benefits, to connect them with case management, to connect them to housing, employment. I mean, it's been so amazing to see the growth and the opportunity despite what's going on right now, and the amazing staff that have been willing to continue to show up 7 days a week, like I mentioned.
Thank you, Greg. Thank you, Brenda. An anonymous attendee is so impressed with how hard your staff is working. Is there anything we can do to support the staff specifically?
The donations of PPE are so important, and the continued support of the community allow us to hire additional staff. We've hired several resident coordinators who are providing some of the 24/7 support for the motel sites, for our residential programs here. That gives our staff more opportunity to have that time off and to have that time away. So support is important. We're providing a hazard pay for all of our staff. We're providing in-person services. We are providing a $500 per pay period, and we have 2 pay periods a month, so basically every other week. We're providing a $500 per pay period bonus for all of our staff who are doing what you're seeing here. It's a significant support for them. It works out to be about $6 or $7 extra an hour, that helps them because a lot of folks who are doing this work are not paid as much as we would like them to be paid, and so it's a way to support them during this time. And the only way we're able to do that is through the support of our community, and that also allows us to fulfill all of our government grants and contracts. There are very few programs that we don't expect to be able to still provide and still complete the outcomes that we've committed to our contracted partners to complete. We have more than 45 programs and services here at Interfaith, and there are 2 that we don't expect to be able to fulfill the terms of. One is our minor home repair, where we go into the homes of seniors and do home repairs, and we've put that on pause for obvious reasons. We should actually still be able to accomplish the grant outcomes longer term, but it's on pause in the short term. And the other one is a new program that launched with the state of California for individuals who are in need of employment and are joint patients of our health center and Interfaith. That will come, but it's been put on hold. That aside, all of our programs continue to operate, even those remotely. So your support allows us to support our staff who are here in person. I'd love to hear if any of my colleagues who are on the call have other suggestions on ways that our community members might help support our teams.
So we are starting to do more tax returns, and we are starting to do them virtually. So if anybody is interested in participating in that or have any experience, or even if you have none, we can definitely send the items that we need for training. Again, as you know, because taxes will be running a lot longer, we'll be doing them year round. And so anytime in between, if you're interested in being a preparer, that would be amazing. We're also starting to do like we're helping individuals register or do like quick returns, so that if they haven't, again, the stimulus payment, if you haven't filed the tax return in 18 or 19, which a lot of our individuals experiencing homelessness have not done, we can help them to be able to apply for the stimulus as well, because they do qualify. And so if you're interested in helping us do that, that would be awesome. I'll put my email on the chat box, and you can give me let me know if you're interested.
I see that Vanessa also added, if anyone is a small business owner or employee, consider partnering with Interfaith to hire clients, perhaps. So thank you, Vanessa, Veronica, and Greg. Greg, you mentioned PPE for staff. What are our needs as far as N95 masks or PPE equipment?
Yeah, we actually have a fair amount of N95 masks that have been donated, and we're preserving those for when we are working with somebody who is symptomatic or we believe may have COVID-19. We have COVID-19 testing capabilities here on site, thanks to our partnership with Neighborhood Healthcare. We also have an isolation room set up. It's actually immediately the wall behind me on the other side of the wall there, our bunkhouse for individuals who are symptomatic and in one of our in our shelter or in our residential treatment program. And so we have that as a place where people can go before they can then get medical treatment and then get into a safe environment. So we're using those N95 masks and the PPE and some PPE for those situations. And we right now do not have any gowns. We have a very limited number of face shields. So those are needed. We need more gloves. I should have mentioned that as well earlier. and the N95 masks are really needed by the healthcare providers. And so I would encourage those who do have those resources to donate them to hospitals and healthcare providers. The small number that we have will hopefully be sufficient for our use.
Okay. I have two questions here related to children and youth. Is Interfaith doing anything to support children who are expected to do distant learning for school, but who may not have computers or internet access at home?
So our two case managers within Carlsbad Unified School District and Oceanside Unified School District are still providing services, obviously virtually or telephonically. All of our schools that we work with and all the schools within the school districts do have devices for families, though. It is only one device per family, but most of the families have been able to work around that if they do have children in differing ages. But so far, all of our students, and we haven't received any word from other students that they need devices other than what the school is offering. And we've connected all of our families, and the schools have connected all of the families with resources for free internet during this time and access to that so that the students can participate in their distance learning. And then we're, of course, supporting to make sure that the students are staying on track and still expected to graduate for our seniors. And you know, it's such a different way of learning. We're just making sure that we're providing that support. So we have a lot of Zoom meetings with our students to help them academically, to help them with their mental health. Our behavioral health specialist is still meeting with students as well to make sure that they're coping and that they have the right skills to get through this challenging time for them. Currently we're trying to plan something special for our seniors who are graduating, you know, so that we could still have a ceremony for them. So we're not quite sure what that'll look like, but we're trying to make it still special for them.
Veronica, I know so many of the families we're seeing have childcare needs, but the question of families without shelter is really a very difficult one. We have a few family shelters that we provide in apartments that we own. Is there anything else, Veronica, that you want to say about our work to help families with kids who we're seeing who have housing as a need?
Yeah, we do have some families that are within our motel program. So they're high needs. Maybe one of the children have asthma, or one of the adults have some underlying condition, and so we have been able to put them into shelter quickly, which has been a real blessing. And so unfortunately, in Haven House, it is an adult-only shelter, but we have been able to try to reach out to Operation Hope and just different resources in the community. We do our best, and I think that what we're seeing right now, and I didn't mention this earlier, but a lot of the individuals that are coming in have never been here before. We had somebody that came in on Wednesday, and it was a single mom, 2 kids in the back of her car, and she was so nervous to drive in. She was like, I don't know if I should be here. I'm so sorry. I have to come ask for help. And the team was like, no, that's what we do. That's what we're here for. No need to worry. Like, what is it that you need today? And she's like, well, we're running out of food and we don't have any income right now. And so we were able to we're touching a lot of individuals that don't know about our resources. And we asked how she heard about us. And she's like, well, my friend told me, and I just needed food, so I came. And so I think the families that we're seeing come more often are the ones that are new to the need, right? And so we're able to connect them with different resources and talk more about how do we increase your income right now? What do we need to do to make sure that you stabilize? And we're having those types of conversations.
Thank you, Veronica. Chelsea, I know we probably have some more questions, but I also would like to ask John Lewis, our director who we heard from earlier, who oversees our recuperative care, if he also could talk a little bit about how our detox and our residential treatment programs are operating now, because those are also unique in that we are still taking in new individuals, and addiction and mental health issues are just a lot tougher to deal with in an environment like this. and we're still doing it. John, can you share a little bit about that for our supporters?
Yeah. So normally with residential substance abuse and detox, they typically are separated. But in light of everything, we have combined both programs, and in order to practice social distancing, we had to reduce our bed capacity by 10, so which leaves us with 39 beds right now, and we currently have 31 individuals in our program right now. So we're still accepting them. We're still providing them the services that they need and transitioning once they leave those programs to outpatient or housing or family reunification.
Brenda, are there a lot of children that we are housing in hotels? And if so, are we able to help with schooling so they don't fall farther behind? That question's from Kelly.
Hi, yes, so currently at our motel in Carlsbad, we are not housing minor children. We do have some families that they have adult children. Veronica may be able to speak a little bit more as to the needs of families in Escondido. I'm not sure if that program may have some smaller children, but our Carlsbad program is primarily consisting of just adults.
Yeah, like I said, I think we maybe have 1 or 2 families, not very many. So again, we really, like, I think Greg said it earlier. It's a challenge, right, to be able to serve entire families that are in need. I think we do that best through our housing programs, though, by getting them with rapid rehousing or potentially a rental assistance to keep them stably housed. We have been. There are still individuals. There are still landlords that are accepting individuals. So we have been able to get people rehoused. So we would go that route with families.
Let's see here. How do we refer people to Interfaith for help? Great question from Meg Decker. Hi, Meg.
So our walk-in or drive-up services are available here in Escondido Monday through Friday. We have morning hours, 8 to 11, afternoon hours, 1 to 3. Veronica, tell me if I got that wrong. And then on the coast, Vanessa, can you give our hours of availability there?
Yeah, so for the coast, you'll want to call in. Our team is able to kind of go and help at the other sites. So our clients do want to call in so they can make an appointment first. The number is 760-448-5696. And I did leave all of our information in the chat box as well.
Perfect. And then we have a pretty quick and easy to see list of these services with access points, phone numbers, and points of contact. And we can be sure to email that out to everyone who's on this call.
Yeah, thank you, Greg. Keisha just asked, is the resource list made public? So perfect. We will share this group after the webinar. It looks like we have answered most questions. Again, if there are any lingering thoughts or questions, please submit those in the Q&A box. Let's see. I think I have got them all. So Greg, over to you to close us out here.
Well, thank you everyone for joining us. I want to thank our amazing program leaders for taking time out of their really, really busy days to share about their work with you. And I want to thank everyone who's on this call. We invited people who are donors who support us. Your investments are feeding our neighbors in need. You're helping our neighbors in need in a time of crisis. And our services have truly never been more important and more needed than they are today. And that will be true tomorrow. That will be true next week. And that will be true in the months and perhaps even the years ahead as we as a society adjust to a new norm. But we're seeing the inequities of our society laid bare. And what we do here as an agency is a group of people of diversity and people of compassion is we help people to overcome those inequities, and we help people to lead the best life that they can possibly lead for themselves and their families. And we can only do that with your support. We leverage a lot of different government resources. We leverage a lot of in-kind donations. And most times we leverage hundreds of trained volunteers, thousands of more transactional volunteers. That will come back. But right now we need your support, and contributions are critical. They allow us to do what we do, and for our staff to feed hundreds of people, to shelter hundreds of people, and to be here for people in their time of need. So I thank you for your support. You took an hour out of your day to join us on this call. Hopefully you learned something. Would love to hear from you afterwards. You can reach out to me anytime as well. My personal cell phone is 858-336-4526. I'll say it again, 858-336-4526. Give me a call. I'd love to hear from you. Talk to our team. And, you know, we're in this together. We're going to get through it. It's going to be a tough time ahead, but we will get through it, and we'll come out stronger as a result. So I really appreciate everyone's support and for being a part of our Interfaith Community Services family.
Thank you, Greg, and thank you all so very much for joining us. Our board chair, Reverend Meg Decker, just reminded me to remind all of you to please help spread the word about Interfaith and all that we are doing and how the community can help. So thank you all for joining us. I hope you stay safe and healthy and have a wonderful weekend. Thank you all.
Thanks, everyone.